So can you describe what HealthTech actually does? Is it disconnected from healthcare?
There's no health tech without healthcare. It is integrated. You cannot just go somewhere and set up your health tech company and not work with any other player. You are on your own. I can design a wonderful website or whatever, but I still need my drugs. They still need to pass through regulatory checks. They need to be stored under certain conditions. Healthcare is a heavily regulated space. So
Hello again, and welcome to another episode of your favorite podcast, Inside the Tech Ecosystem. We're glad to be recording today. Me personally, I'm glad to be recording. Emmanuel, I don't know about you. I always love it when we come together and, talk to very brilliant people on the show. That could be, just you, or maybe we'll have a guest. Emmanuel, I just called you very brilliant. Why are you not happy? Why are you not excited?
I was even shocked. I'm like, when did this one start?
Man, how have you been? What's
I have been good. Very good. As usual. I remember the last episode. I remember my exact answer was, I always say I'm good because I'm optimistic. So I was watching the episode today because we released it today. I was like,
yeah, we did.
Weird.
Yeah. I'm actually trying to
good.
tap in. I'm trying to tap from that, vibe. Nothing
What vibe?
bad. The optimistic vibe, nothing bad affects me anymore. I'm just like, everything will be fine.
It's good. It's good. I like it.
As a Nigerian living in Nigeria, everything will be fine.
You go there, all right.
Eventually. Man. All right, guys. So today we have Zillah Waminaje on the show. Zillah has been a project and product manager within the health technology space for the past 5 years now. And, it's really interesting. This is our first health technology expert. I'm going to, superstar. We're going to call her an expert, a superstar, changing the tides, innovating, right? And Zillah currently works for Salient. And prior to joining Salient, which is our current company, she was a consultant. Prior to joining Salient, which is our current company, where she acts as a consultant on the market intelligence team, Zillah managed and designed project initiatives for, digital health solutions and within the health technology space. So, Zillah has been working. She has this is her bread and butter, which we love and we appreciate, right? Because we've never had a health technology expert on the show. And I have so many questions. I'd love to get into the conversation and just, learn a lot from Zillah today. So Zillah, welcome to the show. How are you today?
I'm good. I'm all right. Happy to be here to share my
we love it. We love
knowledge.
There's no humble person on this show. The last guest that we had, she was a very interesting person. She was flexing on us and whatnot. So that's what we love. We don't like humility. Sorry. So You can tell us. Yeah, you can tell us everything that you've achieved, and we'll be like, wow, that's amazing. Love it. Zillah, I don't think I did justice to your introduction. I found myself fiddling around a little bit. So would you please tell us a little bit about yourself? Who is Zillah Waminaje? And tell us a little bit about how you got into tech, how you got into the health technology sector. We'd love to learn about you.
Yeah, so I'm Zillah, and currently I work with Salient Advisory. Salient Advisory is a boutique health consulting firm where we provide the market intelligence advisory services to global health institutions, and also just global health stakeholders, advising them on innovations that are happening in African health tech ecosystem. And prior to joining Salient, just like you said, I worked in the health tech space and both the profit and non-profit sectors, supporting and managing the design and implementation of different digital health programs for sexual and reproductive health programs, health information management, and also public health emergency management. I have a master's degree in public health, and I'm also a PMP certified project manager.
Love it. That's the energy we want. Tell us all your certification. Tell us all the things we've done. We love it. We love that kind of stuff. So what are some of the, initiatives that you worked on like before joining Salient? Because you just said you led some project initiatives.
Yeah. So I started my career at eHealth Africa, if I want to say. I actually had a stint at the Federal Ministry of Health where I was working purely on public health programming. But then in eHealth, that was where I had the opportunity to be able to support different initiatives. Major project that I worked on, I would say, is during the COVID-19 pandemic. We had this large program, the COVID-19 support program, and we were providing support to the Nigeria Center for Disease Control, NCDC. I'm sure they became popular in Nigeria during that period.
I
Everyone
missed
was
the
seeing
text
those.
messages.
Yeah, so we were in the background supporting to help get those text messages to you guys.
Love it.
But then
Love
at
it.
the same time, the major part I supported in was the e-learning. So we had to come up with like an e-learning program for healthcare workers. So normally the infection prevention control of the NCDC, they go around states in Nigeria organizing this training program for healthcare workers, so doctors and nurses, just on how to prevent hospital-acquired infections. And so obviously we know how COVID was a highly transmissible disease, infection. So during that period, the need for those trainings were like immediate. But then remember we had like restrictions, lockdowns, so traveling was like just a bit of a hassle. And then obviously technology to the rescue, e-learning programs, no need to travel. So we had
Yeah.
to quickly act fast. In 1 week, I think 2 weeks, we filmed like 11 instructional videos. We had to look at the training materials that they currently use, convert that into e-learning materials with what's the name? Assessments, so that when people are done with the course, they take the assessments and then also
Wow.
put it online on the platform. Make sure, set all those things like we're not just taking the course for just taking sake, but that you're actually taking it to like pass a certain criteria and then you get your certificate. So that was really a major part. Another one that I supported was the Lab Information Management System. So NCDC has the National Reference Laboratory. And basically, all your COVID samples that they were collecting during that period was getting sent to the National Reference Lab for COVID testing. And then they will transmit the results to the other states. Obviously, large sample volumes coming in on a daily basis. You will have to like turn your results around in 24 hours. People needed it to travel, And in fact, the turnaround was quickly to know, okay, do you have COVID or not, so that you can start treatment immediately. So they had those huge volumes of samples coming in. They had their own lab information system that they were using to run their things, but it was kind of like a pilot, but just testing it out in this disease area. And then COVID came and it was like, whoo, where do we start from?
Yeah.
Yeah, and so we helped them. Obviously, we couldn't go and start building a new lab information system. So we got an open source one and then worked with the developers of that to customize it for the NCDC NRL's laboratory purposes. So that was one of the things that we did. Not to just sell
we love
marketing.
We love it. We love it.
My career, I've also worked at Great Health. I think that's also one of the exciting periods in my life. It was 1 year. The company was founded in Sweden by Swedish women, but they were focused on sexual and reproductive health for women in Africa. And so we had basically a digital health app and advisor for women. They could use to track their period, use to track their symptoms. And we had customers in Nigeria, we had Kenya, we had Ghana, we had South Africa. So just from this, I think up to like 5 countries. And then we're also looking at moving to the Middle East. And so working with the software developers every day, even the designers and the customer service operators, just to speak to our users, to know what do they need, what new features are they looking for, take those insights, and then also implement like gamification elements in the app to encourage women to track. Because
love it.
One of the things, as a woman, you have to know, you have to understand your body. We're also generating like educational resources for them to understand things like menstruation, even sex, conception, ovulation, just to understand that. And I would say that was one of the most, would like to say, impactful period in my life, because in my previous career at eHealth, I was working often with like the healthcare providers, the government, the public health system managers. And it is kind of a bit difficult to see your direct impacts on the everyday person. But at Grace Health, I mean, I had that interaction. I remember there was one time, you know how you get your reviews consistently from Google Play? And we had this review from this woman who said she was 36 years old. She had a gynecological condition, I think endometriosis or so. And she was like, our app, like using the resources, just learning more about her body, tracking consistently, she was actually able to get pregnant. I remember that they were removing, but it was like a celebration. So those are the moments that give you hope in this chaotic industry that we are working.
Yeah.
Because trust me, health tech is not for the weak. You have to be
Yeah.
And I'm telling you, every day, like, it is something new. I would say, like, I remember during that COVID time, we were working on these training videos, we had finished, the designers had already done the videos. We are just getting ready, doing the final QA checks to set it to the clients. And they were like, oh, WHO has come up with a new clinical recommendation. I'm like, where?
Man, wow. How did you explain this to the developers?
I don't know which one is worse between health tech and fintech, because fintech is what you're explaining sounds very similar to fintech in Nigeria, at least, where government just comes up with one policy and overnight you kind of have to do something about it.
Yeah.
But yeah,
I
you
think
just notice that your cards don't work anymore.
Yeah, well, like you can always live another day. Health is basically life. Like
that's true.
Life and death. You cannot play around. There's no room for errors.
Yeah.
Like your money did not go through, tomorrow it will come through, whatever. Healthcare.
GT Bank, I'm looking at you.
Yeah, in healthcare, like just one specific value off by 0.1, for example, in a lab result or something, it like determines life or death in certain conditions. That is what will help your clinician to be able to make decisions about your health. So in healthcare, you have to be accurate. There's no messing around. So having that extra pressure and dealing with those challenges, man, you have to hold God.
That's interesting, because you already touched a little bit on health tech.
Mm-hmm.
But while I was researching for this episode, I was thinking, I know healthcare. Obviously, everybody knows what healthcare is. But health tech, it seems like this niche industry. We hear them raising money, and they're always raising big money. Like you don't hear health tech raising 25K or 100K. You hear like usually in the millions. So can you describe what health tech actually does? Is it disconnected from health care in a way that for normal tech startups, you can kind of build a tech startup that is slightly disconnected from the industry? But for health tech, I imagine it might be very integrated. So maybe can you describe how that works? And
there's basically no health tech without healthcare. It is integrated. You cannot just go somewhere and set up your health tech company and not work with any other player. You are on your own. Like, it doesn't work that way. If I say I want to set up an online pharmacy, for example, I can go ahead and design a wonderful website or whatever, but I still need my drugs. They still need to pass through regulatory checks, Those drugs, they need to be stored under certain temperatures, conditions. So healthcare is a heavily regulated space. So there's no room for any player to just come in and, do whatever you're doing. So it is closely connected. And that is part of what we're doing at Salient, advocating for the adoption of these innovations. So, in summary, health tech is just basically leveraging technology, to improve access to healthcare services or healthcare products. In summary, in a nutshell, to make it simple. And with health tech, just like in healthcare, we have different customers. We have the patients, everyday people, you and me. We have the healthcare managers. So these are like the, I would say like public health system managers at the NCDC, for example, Ministry of Health. And then you also have your healthcare providers, who are the actual doctors your nurses, your pharmacies, And then on the back end, we also have governments now. I would like to call them public purchasers, global health institutions, then WHO, Gates Foundation, the donors, and the rest. So it's a very interconnected field. And then I've not even gone into the pharma industry, the manufacturers. So
Yeah.
there are a whole lot of stakeholders that are at play here in the industry. And we see these health tech innovations in terms of examples. So I'll start with the online pharmacies. They're one of the largest, players that we see on the continent, advancing access to health products for everyday patients, you and me. We also have telemedicine. Most times we see these online pharmacies offering also telemedicine services, and the telemedicine also offering medication delivery. We see companies like Health Tracker, for example, digitizing lab testing services. So they come to your house, do your testing, and then you get your results on your phone, easy access. And even still focusing on this health supply chain sector, we have different subcategories. We have order and inventory management innovators. And what they do is now, when you go to the hospitals, you see drugs, medications there, they bought it from somewhere. So this
Yeah.
order and inventory management, they focus more on the healthcare providers. They provide like digital marketplaces for these hospitals to be able to purchase drugs from, qualified distributors or manufacturers. Because you know that drug counterfeiting is another issue that we have in Africa. So they provide that. And also, they also help these hospitals to be able to keep track of their inventory. So a hospital A, for example, I ordered 50 packets of paracetamol, 20 malaria medicines, all of that. I know that based on my estimates, I'm expecting 100 patients. I need this. Like to do all those kind of back-end analysis, this order and inventory management innovators provide those solutions. Another subset again that we have, I would say product protection and visibility. So I don't know if you've noticed how some of your drugs, when you buy them, you have this scratch card that you can scratch and send a text
Yeah,
SMS,
I've
confirm if they're
noticed.
valid. Yeah,
Oh,
health tech innovators in operation.
That's
it's not a
nice.
lottery. It's
Yeah,
not a lottery ticket, sadly.
it's not a lottery. It's to save your life. It's to
Fair
safeguard
enough.
So you know that you buy it's we have I think Check It, Sproxil, those are some of like the innovators that offer those services. Even in terms of vaccine now, for example, distributing vaccines, these vaccines have to be stored at a certain temperature. We have some innovators like Figo in Nigeria. They have this cold chain solutions where
Cold storage.
yeah,
Yeah.
exactly. You can track the temperatures and temperature sensitive products as they move across to make sure that they're maintaining their integrity. Also, monitoring the distribution of those vaccines to different health centers to make sure. Even companies like eHealth Africa, they have vast data database solutions in terms of geospatial planning. Agencies like NPAC, the National Primary Healthcare Development Agency, they are going out to the field to do like community immunization, vaccine immunization programs. They need to plan, okay, in Nasarawa State, for example, catchment, hey, how many people are here? Which schools? Where are the catchment areas? Those kind of geospatial planning. There are tools there. These are what health tech innovators are
That sounds like a
developing
lot
to
of
guide
work.
That's
planning. Yeah,
yeah. That's amazing, actually.
it's really amazing. Like I know people, I'm like, when they're like, please tell me about your field. I don't understand. And then when I start telling them, they're like, oh, I didn't know that it took this much for vaccines to just be at the hospital. I'm like, it takes a lot. It takes
Yeah.
a lot. People are working. People are working. But one thing I would say though is it's interesting to hear like feedback that I keep getting from like my peers and people say that okay, I don't really know much about these health tech innovators. What do they really do? I've not really tried this telemedicine platform. How do I know I'm talking to a real doctor? Things like that. And what I used to say to them is that these services are available. That you're not aware doesn't mean that they don't exist. There are people that need them. If you check on your phone, like I want to speak to a doctor, I bet you're going to see a list of health tech companies coming
Startups,
up on your screen, startups
yeah.
coming, and then you click. And some of them you check how much is it. Some of them as cheap as 2K, 3K. That you just know the truth of the matter is that if I want to take a step back, like our public health seeking behavior in Africa is yes, there are healthcare challenges, but then if someone is sick, before you will say anything, you just go straight to pharmacy and collect malaria drug. Okay. I don't need any.
That sounds like a personal shade. It's okay.
It's a personal shade to many people because I know a lot of them. I'm
Yeah.
like, you are going to take malaria. Do you know if it's really malaria? You know? But then you have services where you can talk to a doctor, even on WhatsApp, on Facebook, you know. Easily reach out to a doctor. They will link you up. If you need to actually come into a healthcare center, they can link you up. They do referral services, you know. And so all these solutions and all these health tech innovators, they are present and they are operating on the continent. Last year we did a landscaping of health supply chain innovators across the continent and we discovered like 350. But then this year, what we tried to do was to dig deeper because now we know that these innovators exist. But now our clients, global health stakeholders are asking us, okay, we have this number of innovators operating. Which ones are actually ready to scale and operate at a larger, as a larger scale, I say, and drive impact? And so I would say going forward, we're going to try to see is innovators now, we working together with innovators to actually put together evidence of their solutions on the impact in healthcare, to actually document that. We believe that that will help to foster more government partnerships because, like I told you, the health tech sector is a regulated space. There are still some regulations coming up on the health tech sector, like we have the online pharmacies and the rest, to support operations. But healthcare is a heavily regulated space, and you cannot scale without the government. You have to work with them. They are the ones that own the public health institutions. And no matter the poor state they are in or whatever, you work with them to improve that. And so what we do at Salient Advisory also, apart from providing market advisory services on the innovations on the continent, we also facilitate partnerships between these innovators and governments, and not just government, but also global health institutions, donors that will be able to fund these partnerships because that's what they mostly do. I've worked in the NGO sector. I know the impact the NGO sector has had, even in employing digital health solutions to improve healthcare. But the truth of the matter is that for this to be sustainable, the NGO model is not going to work. Health tech innovators are like the solution. They are like the key players. They are that plug. They are the public-private partnerships that need to happen in the sector to be able to drive change. And so that's what we advocate for. We also help the innovators, we do this partnership readiness assessments, working with innovators just to make sure that their books are in order, they are telling their stories more effectively, documenting their impact. We're even working with a few innovators now to help them conduct actual impact evaluations. Because in healthcare, before your drug or whatever solution is adopted, there has to be a randomized control trial. There has to be studies, clinical trials, rigorous evidence to show that this actually works. Because I said, we are dealing with human lives. It's not about human lives at the end of the
Your
day.
industry doesn't play.
Out for,
I love it.
Yeah, it doesn't at all.
Don't play here. It's serious work. So if you come and shout and say, "Oh, it has done this thing," where is your evidence? Let's
show workings.
Not not all this church. Show your work.
Yeah. So I think that we should talk a little bit about Salient Advisory because that's what you're referring to when you say we, right?
Yes.
So tell us about the company, and then we can go dive into the report, which is going to also talk about all the partnerships and all these things.
Yeah. So, like I said, we're a beauty consulting firm, and we provide market advisory services, also facilitate partnerships between health tech innovators and governments, global health institutions, and also facilitating market access support. But one thing that we also do is to support governments with regulatory advisory services, especially around online pharmacy regulations. I think last year we had this regulatory learning group across 15 African countries. In Nigeria specifically, we helped to revise the online pharmacy regulation. And we could like to call ourselves a small but mighty team. And we're distributed across Nigeria, Kenya, Morocco, and Canada. And we're really passionate about just highlighting innovative models that are able to deliver healthcare services to Africans and also facilitate these partnerships. We actually started out in 2020, and since then we've been able to.
So, pandemic?
Well, I would say Salient Advisory in quote was operating under another umbrella from like 2018-ish. Then we
Oh, okay.
evolved
Yeah.
to Salient Advisory. Yeah. And I think we've released up to like 14 market intelligence reports. Most of
Oh,
them
okay.
are covering,
Including the one we're going to talk about, right?
yes, including
Nice.
the one that highlights the 24 leading health supply chain innovators. And aside from this market intelligence reports, one key achievement we've been able to do is to drive the launch of a market acceleration program for health tech innovators, which is the Investing in Innovation program, the I3 program. The program actually started in 2022, and so far we've been able to help to provide grants to 60 African health tech innovators. And I think the African Health Tech Summit is happening right now, and we are just about to launch the second phase of the project and the program, IT program. And the team has like an ambitious goal to reach to support innovators to be able to reach over 200 million patients, with life-saving health products and just create,
Is
That's
that
nice.
across Africa?
yeah, across Africa. Across Africa.
It
Okay,
would have been
nice.
nice if it was Nigeria. Because that would
No,
be
I
like
mean Nigeria.
almost the entire population.
Nah,
Nigeria,
come on.
Nigeria,
We're not all
now,
sick in the country, Emmanuel. We're not all
You think?
patients.
I think
Wow.
in Nigeria,
Wow.
what we need is mental health support. Right now.
So let's dive deep into the report. So the title of the report is Leading Innovations Enabling Health Product Access in
Yeah.
Africa. Of course, we've read the report. Okay, not all of it, but the summary. But I would like you to describe what this report is about and why you did the report in the first place.
Okay. So basically, our work in the past has been more of like just providing an overall overview of the landscape, what's going on in African health tech, with sometimes a narrow focus on health supply chain sector. And I think I'd mentioned it that there's been this push from our clients and even other stakeholders, to see what are the deeper insights, who are the innovators who are ready to scale, like who are those innovators that have achieved product market fit and now they are ready to actually be integrated into like our routine public health systems. And so with this report, the latest report, what we tried to do was to narrow our focus to say, okay, see, who are the leading health supply chain innovators across Africa? And we're able to identify about 30 of them, but then we only collected data on just 24 of the companies. And these 24 companies, when you see them across Nigeria, Kenya, Egypt, South Africa, a host of other countries, they've been in operations for like 10 years on an average. And collectively, we see that they've partnered with over 100 manufacturers, 75 public health institutions. They've been able to reach nearly 50,000 healthcare providers and deliver products to like millions of consumers. And when we even look at their revenues, just in 2023 alone, last year, they generated nearly $200 million in revenue. In fact, there was one company, Health Access Technology Platform in Kenya. They accounted for like 51 million of revenues, and that's
So
largest.
what
Yes,
are they
that
called?
Kasha.
Kasha? Oh.
Kasha
Yeah,
is.
they spell
Can you spell that for us?
Kasha.
Okay.
Yeah, it's different from Klasha.
Sounded very close. Sounded very close. I was like, when did these guys start doing health? Well, it's fine. It's fine.
Oh, there's a company called Klasha.
Yeah, that
There
one's
is.
fintech, right? Is it
Yes, I
fintech
think,
or edtech?
yes. I think it's fintech. I think Clash is
Okay.
fintech. Yeah.
Oh, okay. So, but this is Kasha. They're doing
Okay.
really good work. Kenya, Rwanda, I think, or the 7 other countries also. And so, and in this report, among these 24 innovators, definitely operating across 5 major categories. But the 2 dominant categories are the order and inventory management innovators and the online pharmacies. So I think I talked about this order and inventory management innovators, basically helping focused on the healthcare providers, making sure that drugs are available at the healthcare facilities, they are managed effectively to also prevent like wastage, so that drugs are not just there and they expire. And then we have the online pharmacists who are facilitating access for like everyday people like you and I. And basically, half of these 24 innovators, these leading innovators, they operate in the order and inventory management category across 30 countries. there are only 4 online pharmacies in this report. But then these 4 online pharmacies, they're reporting revenues of around $90 million. And we also see like other categories, product protection and visibility. The example I gave with scratch card, like just protecting drugs to prevent counterfeit drug. And then medical drone delivery. I'm sure we've heard of Zipline. I think the other one was weak.
Yeah, Zipline is
I
like
saw that,
so amazing.
Yeah.
I saw that on I think on LinkedIn. I saw a post about Zipline on LinkedIn, and I was so impressed. Right. I want to ask you a few questions. They may sound very ignorant. Maybe I should have done my research.
Okay.
But we have an expert here, a superstar, everybody. So, I mean, I don't mind. So, like, it's interesting to see companies like Zipline pushing this kind of thing, especially on the continent, right? So, where do you see this? Because I don't think they are like mainstream right now. I've never seen a Zipline thing in Nigeria, right? But
exactly.
what?
Well, they're in Nigeria. They are Nigeria.
Oh,
Kaduna State.
really?
Yeah.
But you don't need it, Trigger. That's the thing.
Chill,
That's
Emmanuel. Chill. Kaduna State.
But
Interesting.
let him learn. Let me get his question.
So basically, if you say Kaduna, okay. So what is the? I would ask, what is like the success rate so far for their operations, like operating in other different countries and Kaduna State? I never knew they were in Nigeria. And what do you think the future for such a company is like currently?
Okay. So with Zipline now, basically what they do, why you would not see them, why you say they are not yet mainstream, is because you are not living in a hard to reach area.
Zipline.
Go to a healthcare facility, you would have to cross boats. What they do is, if you even check videos online, see how their operations run, they have like a center somewhere, and then they set up the phone, and it goes to do the drop-off at certain locations, maybe like community health posts. Some of those places where they are reaching, maybe if they have healthcare facility, to be like one very, just a small place for people to have healthcare. So they actually distribute products. It's hard to reach areas, so that's why they won't seem like mainstream. But to be completely transparent, there's been acknowledgement that their services might not really be cost effective in the long term for governments to pay. I know in Ghana, for example, and funny enough, Zipline is one of the companies that have been able to do impact evaluation. So just to show that openness and transparency, on the actual impact they've been having. They've been tremendous in increasing availability of products in sexual and reproductive health products in Ghana, for example. I think up to like 60 or 70%, but that is a bit dicey. But I know they'd help to reduce stockout rates a lot. And even when they did the impact evaluation, the Ghana Minister of Health then was like, okay, these people, your solution is very fantastic, but can we pay for this? Can it be sustainable? No. So what we're going to do now is to reduce the use of this service to be focused on only essential health products. So we can't use them to deliver all healthcare products, but the essential ones. So you see why this goes back to the importance of doing those impact evaluations to see where can we generate cost savings? What is the actual impact? Just to make sure that we're using these solutions in a smart and efficient way. So Zipline has been doing fantastic work in improving access.
Shout out to Zipline.
Yeah.
And
amazing stuff.
Innovators, I'm not biased.
Yeah. and other health. Shout out to you all. You guys are doing amazing work.
Fantastic. Fantastic.
I'm curious. Do the drones go back, or it's just a one-way delivery thing?
They'll just go. They have this point. They drop, and then it goes back. And if you see the machine that catches the drone, is a very fantastic setup. You can look them on YouTube and see.
Yeah, I saw a video of how they send it. So it's kind of like a catapult thing.
Yeah.
So the drone is kind of like shot into the air, and then from there it picks up and delivers. I don't know how it comes back. Do they have that same thing? So it just
it just drops. It doesn't stop. It doesn't land. It just comes and not it drop it.
Oh, okay.
It goes back, and there's I think there's something like if it misses the catch, it will have to go again, come back. It has a sensor to go back to that.
That's crazy.
You know,
and the guy's story is also amazing.
Mm-hmm. What?
Yeah.
You know what I'm scared of? I'm scared of
What?
people catching up to what zipline is, and then people on the streets waiting to say zipline drone. And it's just I'm scared of that because no, and no shade to my countrymen. I love you guys, Nigerians, but some Nigerians have been known to to do some very shady stuff sometimes. I hope there's some protective measure to make sure that that doesn't happen because the healthcare service, the medication needs to reach the people that actually need it, right? And sometimes human beings can be
I'm
selfish.
pretty
and
sure.
they don't
I'm
think
pretty
about
sure
that.
they have measures
Yeah.
because they've been operating for a very long time. I've kind of followed their story, and the guy's story is actually very inspiring. You should actually look it up. I
Once
think he
again,
moved
shout
to
out
the US
to
and then
Zipline and everyone else. You guys are doing
And
amazing
everyone,
stuff.
Yeah.
we also have some local, what's in the medical drone operators coming up. I think there's one.
Oh, nice.
They even started
Arena.
East, yes, Arone, if I believe.
That's nice.
Yeah, but I'm not sure if they are into healthcare right now, maybe other sectors. But yeah,
Yeah.
a lot of exciting innovations. It's really, really interesting to see.
Yeah.
Really, really.
Yeah.
Um,
Let's deep dive a little
Yeah.
more into the report. So one of the outcomes of the report is about like how government partnerships can help. So I'm wondering because with government partnerships, things like bureaucracy comes up, payment cycles, regulations, all of those things. So can you talk about how this would impact the partnerships? So is it going to slow down the innovation? How can the government also try to be less
Bureaucratic.
balance,
Governmenty.
bureaucracy, balance bureaucracy regulations without stifling innovation?
Obviously, innovators have been working with government. Last year, we saw nearly 50 partnerships between these health supply chain innovators and government. But then, obviously, challenges exist. And just as you were saying it, like the payment delay, when my face changed, it was like just recalling everything that we keep on hearing. Oh, slow processes, contracting, and all of that. But what I would like to say is that it's a learning opportunity both for government and innovators, because it's having to balance that thing of government and in fact healthcare sector. First, do no harm, the Hippocratic oath. First of all, no harm to anybody. But then we have the health tech startups and startups in general. Fast, feel fast and learn. How do you find that balance? That is what I feel like we've been trying to accomplish. And payment delays is definitely a big factor. But then speaking to most of these innovators and even the government, one thing they say is they know the payment will come. It's just when. That's the most important thing. But then that's where donors and JHI is coming. One of the things we've advocated to them and we keep advocating is you can help to maybe create like a revolving fund that can help to de-risk these partnerships. So you pull funds together, be able to fund the partnership. Whenever the payment comes from government, it just replenish that fund and then it continues. That's one way. That's one thing we've been advocating. But at the same time, we've also been pushing for new, will I say, contracting and payment approaches, like results-based financing. When payment is released based on certain outcomes. And what the will I say the premise behind that is to show how when you see something working for you, you can see the results. You would pay for it. You'll be eager, okay, we want this. Yeah, we want this to continue, And so to just adopt both government and innovators coming together to just find out, okay, what is the best contracting approach for us? What would work for you? What would work for us to make sure? Because innovators, they are not fetching money from air. They need money to run their operations, basically.
Yeah.
But government at the same time will be like, yes, you will get your money. Just be patient. So just having that balance. But we truly, that's why we keep advocating for government, these donors. Sorry?
Is that a global problem, or do we just see that with governments in Africa?
I won't say it's just an African thing. I mean, governments are government. It's a public health institution. Why? Because you have different layers of management and everything. Well, I would say, I don't know if anybody has done any comparative analysis to say, oh, it's faster here or whatever, but I bet you if you check everywhere, government bureaucracy is a common challenge.
Fair enough.
Yeah, I can imagine.
It is, but at the same time, we need to. I not because everyone keeps saying government bureaucracy, and not to paint government in a bad line, like some of these processes are there for a reason. They are not just there
Yes.
for to
Sure.
stringent or whatever. There's a reason.
Sure.
Yeah.
If I want to give an example, when we were even trying to revise the online pharmacy regulations in Nigeria, where did we see some clauses, like working with the regulators, Pharmacy Council Nigeria, we asked them, why do you put this clause here? What is the reason? What are you trying to achieve? And they're like, to be very clear, a clause was like, okay, you can speak to a doctor through an online pharmacy, but whatever prescription you use, you cannot use prescription from the telemedicine platform. How is that now efficient? Exactly.
How's that
But why
helpful?
was exactly
Yeah.
why was that there? It's because they said they need to know if if the person you're speaking to is a licensed operator. That's the reason why. So we were like, okay, instead of having this clause, what we could do now is to make sure that before these online pharmacies are even registered, make sure that whoever they're talking to, like, has already gone through the registration with PCN. Do you see how we come together to work with the government? You can make all those kind of allowances, So
Fair.
it's
Yeah.
exactly, because that's why I said with people say bureaucracy, that's an issue, but there's a reason why those processes are there. So it's kind of thing like,
Yeah.
want to work together. Let me understand things from your own point of view, see it from my own point of view, and then see how we can come together to find a way. And this is where we see these global health agencies and donors playing a big role, because they have the influence with government stakeholders. They provide a lot of funding, development aid. And so they are able to come in to help to facilitate these partnerships and even fund them, and also to make them sustainable. And aside from the challenges, one thing else I would say is this impact evaluation. I think I had mentioned it before. One of the things for governments to be able to say, okay, let us take up your solution, there needs to be evidence to say that, okay, your solution actually worked. And if you're deploying a solution in a healthcare facility, for example, or whatever, to be able to track the impact, there has to be like data collection consistently and all of that ongoing. But then it takes close collaboration between the government and the innovators to be able to implement that. At the same time, innovators have told us that, they have their actual work to do. So this impact evaluation might be an additional layer. So we also see if it's possible for global health institutions to help these innovators to be able to conduct this impact evaluation. Like I told you at Salient Advisory, we're supporting 2 innovators, I think, with impact evaluation. That will come up, I think, by next year or the upper year. Just to confirm. And BMGF is the one that is funding that impact evaluation. So these are some of the ways that we can help to support these innovators to generate evidence of their solutions impact, and then be able to get more partnerships, and scales for larger impacts. And what else again on government partnerships? I think
Yeah.
I've said a lot.
Yeah, I think you've already. Yeah. So I
Thank
was
you,
also curious
Zillah.
about the financial part. You kind of mentioned it slightly, which is, as a startup, you have to make money, right? And you're selling to either government or something, and then the payment cycle is taking a long time. But you already mentioned that you have GHIs, global health institutions, and donors that make. But if you're a startup founder, do you think you would want to put your faith in that, or risk the success of your company on donors? Are there other ways that they can, I don't know, figure out this financial part?
I think so. What we say the revolving fund, we call it to de-risk partnerships. I don't think
Okay.
we see this as a continuous at a long run. Is donors that will continue paying for this.
Okay.
What the fund helps to do is to kind of, I would say, allow innovators to deploy their solutions with governments, take learnings from that, adopt it, adjust it. For example, you might deploy now, if you get partnership with a government agency with your solution, as you're ongoing with the fund that you get from the GHI, it might be deployed, for example, maybe across an entire hospital healthcare department. But in the long run, you see that, okay, maybe we don't really need it here to be more efficient here in just this small department. And then we deploy that, and then government can take up paying for that. So that period, you have that period, to adjust and learn to come up with even what is a sustainable way for us, for government to be able to adopt. Because when you from my own experience now, if I'm talking, whenever we get funding to deploy all these solutions and everything, a major part at the ending is sustainability and transition plan, where we start training even the government officials themselves to be able to take ownership of this platform. I would say in Nigeria, I'll have to give a big shout out to NCDC, because when we started working with them initially, then most times, I mean, you guys are software engineers, most of the solutions we're building were like on our own database or platform or something like that. But it got to a time when NCDC was like, don't build it on your database, build it on our own. We want our data. So it was very, very
Nice.
exactly. So that's goes to show, they'll be like, when you come with your software developers, no problem, you will meet our own. Come on, so it was interesting to see that capacity development. So, and all of that started from one program now. So this is the kind of sustainability that will happen in the long run. And then governments
Yeah.
will be able to liaise one-on-one with innovators. But even at that now, there are government agencies that are relating one-on-one, paying for their services without any involvement from donors or global health institutions. I know of Life Bank and the Yobe State Drug Management Agency is a direct partnership with no involvement from any GHI right now.
Yeah, thank you so much, Zila. I want to ask, what are you most hopeful for in terms of health tech in the continent? Like, what is something you're looking forward to the most? Right? It could be 5 years from now, 10 years from now. It doesn't matter.
For me, I would say there are two things. The first one is data interoperability. Is a big factor for me because we are seeing so many systems coming up, telemedicine, online pharmacy, different digital electronic healthcare records, and all of that. For me as a patient, it's annoying where I start from my family hospital and now I go to another hospital as an adult and you're telling me all my files there cannot be moved to another, because it is chaotic for me. And so as I'm
So you have to
seeing
start from
hospital,
scratch?
exactly. When you go to a new hospital, they create a new file from you, except you go to the hospital and get someone to help you get your file. Like
Okay.
having access to my own healthcare data shouldn't be hard.
Yeah,
So
true. I agree.
personally, yeah, for me, if you say what I want to say is that as more digital solutions are being developed, I want us to also incorporate this interoperability. How can these systems start speaking together? I know the African CDC has released some guidelines and recommendations for how African governments can start developing their own national interoperability guidelines using the same language across board. Because even if you work in public health programming, the urgency of like decisions that need to be made rely on high quality data. We cannot be waiting for data from one system and another one to do. Like amazing to see the overlay when you bring lab data data from the field cross. Like if all those systems speak together, it will make everybody's work easier and life easier.
Yeah.
For me, as a professional in the field, I look forward to that. I also hope that more health tech innovations become more mainstream, even for the everyday people. I so much have faith in the online pharmacies especially because I see them adopting not just their online pharmacy, but then integrating these telemedicine solutions, and also just bringing that comprehensive end-to-end patient care for every user. The way we in fintech, like I say, we were using fintech apps. We have like Piggyverse, Riseverse. Like I don't know anything about investing. Riseverse just does it for me. So it's the same. I look forward to the day where we just have a health tech solution. Like this is my health tech advisor, something like that. It's just easy. I want to do that.
I love it.
We have that right now. Health tracker. And what's the name? Telling Numa Care, some other apps like that. You can just easily with a click of a button. But I would like to see more integration and consolidation. And I think that's what we're going to be seeing going forward. And also
amazing.
to wrap up, government partnerships, more government partnerships.
Government partnership. Government, you can hear.
They are ready to work. These guys are good. Like in COVID, they played a huge role. And even in our everyday routine public health programming, disease surveillance, like their solutions are amazing. They are ready to work. So please adopt their solutions.
Awesome.
Government, you can hear. Zilla, would like to thank you so much for coming on the show. Really, I personally learned a lot. There were a lot of
I
um,
also learned a lot.
there are a lot of acronyms and abbreviations being thrown around. I love it. I love it. So thank you so much. We usually close off the show by asking our guests a simple, non-tricky question, and
Yeah.
we all know, everybody listening to this knows that you're a health tech expert. You're a superstar in your field, and we love it, right? But like, if you never ventured into this, what is something you think you'd currently be doing right now?
Hmm. I'll be sleeping in my house. If you go to like Greece and some other countries like Italy, they take siestas, they just live life easy.
Vibes.
So I will just
Fair
sleep, and then
enough.
the evening, like around 5 or so, I'll open my restaurant, serve tea, then we'll go for dinner, then maybe just relax. So I'll just rest. But someone had to now flip the question, funny because you keep asking is like, oh, if you had to do anything, if like you had all the money in the world, what
Yeah,
would you do? Will you still be working in healthcare? And the truth of the matter is yes, that's for me. I would.
that's amazing.
Yeah, getting into the space has never been about money. It's just like it might sound cliche, but I am really, really passionate about like healthcare. I really want to help improve healthcare access for all, leave no one behind. And just like I said, when you see some of the impacts that these innovators are having is amazing. In these reports, we had the opportunity to do field work, and I
Yeah,
remember one of the pharmacy business owner who some of these other inventory management innovators are working with. He said, I have my money, I have my list of drugs, but I cannot get it anywhere. But if I carry my phone or the app and call them, immediately they will get it for me. So when you hear those kind of real life stories, it makes you exciting, and it just makes
yeah.
you excited. And so these are the things that I look forward to. But in
Yeah, I
summary, if
agree.
I was not doing this, I'll be at home and open a small restaurant.
Good answer. Good answer. Well, thank you so much, Zilla.
Thank you so much for listening to this episode. We release new episodes every month. If you haven't, please subscribe to the show on YouTube, Apple Podcasts, Spotify, or wherever you get your podcasts. And if you enjoy the show as much as we do, don't forget to leave us a 5-star review so we can reach more people. Shout out to the amazing team behind the show. This includes John, Faith, Angela, and Okechukwu. Connect with us on social media at Inside the Techos on Instagram and Twitter, and Inside the Ecosystem on LinkedIn. Be one of the first people to get the latest news, updates, and announcements from us by subscribing to our newsletter. We promise we only share the coolest stuff. All right, see you in the next one.